Hello and welcome back. So the next videos, probably the next 15 videos, are going to talk about some of the other osteopathic trainings. So we're going away from the upper craniosacral therapy, the somato-emotional releases. After I'm finished with the series talking about different and explaining the different osteopathic modalities, I will dive much deeper into more the psychology, metaphysical parts, knowing who you are, transformation. But bear with me, I want to mention also those manual trainings because they are always going to be a part of your session because it is in my hand. It is the knowledge, the anatomical knowledge, the training is just within me as a practitioner. So the first one I'm going to talk about is visceral manipulation by the Barral Institute. Jean-Pierre Barral is a French osteopath, and he developed the curriculum. He works under the IAHE, which is the International Association of Healthcare Educators, so basically Upledger Institute. And I'm just going to read something short to you about visceral manipulation. It is a gentle hands-on therapy that focuses on the mobility and natural movement of the internal organs, their connective tissue, so fascia, and their relationship to the rest of the body. The approach is based on the idea that restrictions or tensions within the organs and fascia can affect posture, pain pattern, nervous system function, circulation, and overall health. And using subtle palpitation and precise manual techniques, practitioners assess how the organs move and interact, and then will help release the restrictions. I always help releasing restrictions, with the main organs, liver, digestive system, make sure everything is moving correctly. So we release restrictions to restore the balance, adaptability, and communication within the body. Visceral manipulation is really good for chronic pain, digestive issues, post-surgical adhesions. I think every visceral manipulation class I took that focused on the abdomen, my appendix scar, has always been an issue. It was true because of the adhesions and the effect on the large intestine, ovaries, the liver, the entire system, balance, postural balance. So emotional stress, we can hold that obviously in our digestive system, or even the heart and the thorax. Complex whole body dysfunctions, and we differentiate between mobility and motility. So mobility refers to how the organ physically moves in response to external forces, and motility is how the organ's subtle inherent internal motions based on embryology. So we're back in craniosacral work, the biodynamic work. So it's the intrinsic rhythm, life movement. So when I work, I consider it's also considered direct, indirect techniques. So most of the time when I treat the organs, organs are always part of the treatment. Doesn't matter if I do cranial work, the visceral work, even the osteoduth, the hands-off work. I scan the organs and I treat and release your embryological patterns. So I prefer to use and work with motility. So it's more the passive treatment, but certain treatments also include mobilizing the organs, depending on the restriction. So in simple terms, mobility, movement from the outside, motility, movement from within. In my next video, I'm going to talk about the 6 visceral manipulation classes and what they focus on. So it's going to be a quick overview of visceral manipulation, again, Barral Institute. And I hope you enjoyed this brief intro to visceral manipulation so you get an idea of what we're working with. Thank you.